Hi everybody, today we're going to continue learning about epidemiology and biostatistics by taking a little trip to the fictional town of Epiville. So now that we're all residents of Epiville, we found out that there has been this amazing news. There is an outbreak of Susser syndrome, a rare and debilitating neurological condition. And our lovely newscaster here has shared with us that doctors at the Epiville General Hospital have seen a dramatic rise in the number of patients suffering from this syndrome, which is, as we said, rare and debilitating. And it causes a number of symptoms: dizziness, double vision, fainting spells, difficulty with concentration, and also some more severe symptoms like the inability to smell, facial tics, loss of conscious body control or proprioception. We know that first cases of Susser were seen following an outbreak in London and following World War II, but we've never discovered the cause of the disease. In the United States, there have been some sporadic cases that have found, but hospital officials have seen a steady rise of new cases over the past 2 years, with a dramatic upswing since March of this year. And so the Epiville Health Department has deployed a team of public health officials, that's you, to determine not only the magnitude, but try to figure out, again, what are the patterns of disease and how can we control and prevent this from happening to other people. Doctors have warned everybody that everyone's at risk. However, our intrepid reporter has found out that many of the people infected were members of Superfit Fitness Center, which is located in the Epiville Industrial Park, and has further found out that Superfit is owned and operated by Glop Industries. Now, when initially the news went to Glop, they declined any comment. So, what's our plan of action? So based on this information, what's your first step? So if you think back to the previous video when we talked about how to look at an outbreak, the first thing we need to do is determine, is this an epidemic? Is this more than what we would expect? And also, where should we go to get more information? Well, we know that most of the people were members of Superfit, and we know that Superfit was owned by Glop. So it might be a good start to go talk to the people at Superfit. So here we have the website pictures from Superfit. It's been owned and operated by the Super Clean Corporation. It has state-of-the-art equipment, indoor swimming pool. It's a really lovely place to be. In addition, members can exclusively purchase various products from their cafeteria. And all of their products are manufactured by Glop. So, located in the heart of Epiville Industrial Park, Superfit is your first step toward a better body and healthier mind. And it's open to all residents of Epiville. So, how about we talk to Mr. Crunch over here, the Superfit Fitness Manager? Well, as your role as a health department official, you're allowed to speak to people who may be knowledgeable about disease outbreaks. And so Mr. Crunch says, I've been here a manager at Superfit since we opened. Superfit is actually owned by Super Clean. They have nothing but state-of-the-art facilities. He thinks it's a wonderful place. They even have their own gift shop. So Super Clean has licensing agreement with Glop, and as a result, they only carry products manufactured by Glop. And they sell some things here that you can't get anywhere else. Things like the sports drink Quench It and the energy bar Enduro Brick. So those cannot be found in retail stores. And to make things easier for their membership, they don't even have to carry cash. They can just swipe their card and it will keep track of their purchases. And so, in terms of people getting sick, well, people get sick. Who hasn't been sick? What's the big deal? We don't think it has anything to do with us. So what information have we gotten here? So we know that most of the people who are getting sick are members of Superfit. We know that Superfit has some products that are only found there. And they're manufactured by this Glop Industries. And so we go to visit Glop. So over the past 3 years, Glop has been under contract to manufacture a multi-purpose cleaning solution called Super Clean. It's a strong antibacterial agent. It's good for preventing staph infections, athlete's foot bacteria. So it makes sense that they would partner with a health and fitness facility. Additionally, GLOP has contracts to manufacture other products such as the sports drink Quench It and the granola bar Enduro Brick. And so we go, and now we're going to talk to the foreman, Mr. Hank Lockjaw. And Hank Lockjaw is a third-generation GLOP man. He's been working here. His dad worked there. His grandfather worked there. And he was promoted a few years back just before they started making Super Clean. And he shows you the line of Quench It and the plastic bottles that they use that are filled. And as he says, the hard part is making sure that those bottles stay nice and clean before you fill it with something you're going to drink. And so just last week, they installed a brand new sterilization system. Up until then, they were using Super Clean to sterilize them before adding Quench It. And before that, they just used hot water. So now they only use this gamma radiation trick to sterilize the bottles. It's more clean, it's more efficient, in the longer run, it's better than using Super Clean. But they only switched last week. Important information, because think about when the uptick in cases started. The bars ride on the Enduro Brick on the other side. They ride along on this conveyor belt, and that bakes them and sterilizes them as well. And so he says, look, things run nice and smoothly here. There hasn't been a single breakdown. It's not us. It's not coming from us. It's not our problem. And so here we see Super Clean, the antibacterial agent that leaves your hair, body, and industrial manufacturing operations oh so fresh and clean. So now we just need to figure out what study design. So you have now thoroughly assessed your situation. What might be some of the causal agents? What might be causing susser? Well, one of them might be and Quench It. Another might be Enduro Brick. These are two products that are made and served exclusively for members of Superfit who are largely accounting for the number of cases. And so how can you go about answering your question? Well, we could use something called a case control method, which would allow you to compare people who consumed those products amongst people who are healthy and people who are not. So if you remember back to the outbreak of enteritis, we looked at who ate the foods and who didn't eat the foods, and of each of those cases, who got sick and who didn't. And we calculated some rates. So, based on the information you gathered, which hypothesis do you think is going to be best for your case control study? Cases, again, being individuals who are sick, and controls are people who are not sick. Would you pick A, those who consumed Enduro Brick are more likely to be diagnosed with susser than those who did not? And as a secondary hypothesis, those who consumed Quench It are more likely than those who did not? Do you want to pick B, individuals diagnosed with susser syndrome were more likely to be members of Superfit than individuals without it? Or C, individuals diagnosed with susser are more likely to be exposed to a variety of different exposures than individuals not exposed to susser? So take a minute and think about it. Just put the answer in your head. So the correct answer in this case is A. These hypotheses clearly state the expected causal factors, Enduro Brick and Quench It, and the expected direction of the effect. They are sufficiently explicit to allow the hypotheses to be tested after collecting data. In addition, we know that although this methodology selects people based on the disease status and compares the exposure distribution between cases and controls, a properly conducted case control design can compare disease experience of the exposed to the disease experience of the unexposed. B is not correct because it's not specific enough. Affiliation with Superfit Fitness Center can be associated with many different factors. And a study hypothesis needs to be clearly defined in terms of exposures and outcome. And C is incorrect because it does not state a potentially causal link between the exposure and the outcome. And therefore, it's not specific enough to allow for data to be collected to either support or refute it. Now we need to decide who's considered a case and who isn't. So what information do you need to do this? Well, the first place to start is to determine, well, what are the symptoms? And once you have the clinical disease, how does it manifest? And so the Epiville Department of Health has outlined the various things. So since March, A number of residents have been complaining of these sort of non-specific neurological symptoms: dizziness, double vision, fainting spells, difficulty concentrating. Those could be due to Susser or could be due to any number of other things. But they've also identified more specific symptoms that are indicative of this rare condition. So the loss of the ability to smell, the development of facial tics, your inability to control your body. So it's called impaired proprioception. So you can't stand up without falling down. And they've developed these 3 stages for classification. So patients with a positive MRI and minor nonspecific symptoms. Stage 2, you have more pronounced symptoms of stage 1, as well as this inability to smell and facial tics. And stage 3, where you have all of the stage 2 criteria, plus this inability to sort of stand up without falling over. They've determined that Susser syndrome is not fatal, but may require hospital care and treatment for the severe disabilities. And the induction time is thought to be at least 6 months from the first exposure to the first appearance of symptoms. Now remember, think about what good old Hank Lockjaw told us about when they changed, right? He had been there for quite some time. It was only within the past week that they changed over to this gamma radiation. And prior to that, they were using Super Clean to rinse the bottles that were used for Quench-It. So, what do you think of which of the following do you think is the best definition for cases? Cases should have been members of Superfit Fitness Center for at least 2 years of the last 6 months and consumed either EnduroBrick or Quench-It. Cases should be correctly diagnosed with Susser syndrome and employed at Glop Industries. Or cases should be correctly diagnosed with Susser and been a member of Superfit for at least 6 months in the last 2 years. So just take a moment and think about what your answer is. Well, A is incorrect. It may seem obvious, but it's important to state that cases need to have been correctly diagnosed with Susser syndrome. Additionally, we are interested in determining the exposure status, and thus we can't require that all cases have been exposed. Finally, it's really important to separate the 2 exposures and to consider their effects separately, because some people may have consumed EnduroBrick and others Quench-It, and not everybody consumed both of those. B is also correct. We are interested in possible exposures at Superfit and not at Glop. Therefore, employment at Glop Industries should not be considered an eligibility criteria, which leaves us with C. We want our eligibility criteria to be as specific as possible. We've already stated the desire to limit the study to Superfit members, which will make the selection of the control group easier as well. We'll get to that in a moment. And it's crucial to incorporate time elements into our study design that our exposure of interest could have plausibly been associated with the development of Susser syndrome. Without these criteria, we cannot proceed to statistical analysis of the suspected associations. So now we know who our cases are, who has the disease. We also need to develop a control definition. So valid controls in a case control study are individuals that, had they acquired the disease under investigation, would have ended up as cases. So they need to be potential. They could have potentially become cases. And the best way to ensure this is to sample controls from the same population that gave rise to the cases. And to ensure that the controls accurately represent a sample of the distribution of exposure, they should be sampled independent of exposure status. So again, these are simply people who could have become cases, who come from the same population, and you don't want to know about their exposure status. You're not selecting on that at all. So knowing all of these things, who do you think would be the best criteria, or which individuals would fit for controls? Do you want controls should be residents of Epiville who have not been diagnosed with Susser? Members of Superfit who have been diagnosed with Susser but not consumed Quench-It or EnduroBrick? Or members of the Superfit Fitness Center for at least 6 months in the past 2 years who have not been diagnosed with Susser at the time of data collection? Well, A is incorrect, because while it's correct that they should not have a diagnosis of Susser, it's also essential that cases and control come from the same source population. So in this scenario, cases from the population are people who attended Superfit Fitness Center, while controls would only be coming from the general population. Since the exposures of interest are only at superfit, selecting controls from the general population will artificially create an association between those exposures and that outcome, since the controls do not represent the exposure distribution of the source population giving rise to the cases. More simply, controls under this scheme would not necessarily become cases if they were diagnosed with disease, since cases are restricted to superfit members. B is also incorrect because controls should not be diagnosed with Susser. Our controls are people who are healthy. Additionally, since we are interested in the effects of the exposure variables, we should not select our controls based on their exposure to EnduroBrick or Quenchit. Selection of controls must always be independent of the exposure, which leaves C, which is the correct answer. An important point is for the controls should be classified as cases if they develop Susser. In other words, controls should meet the eligibility requirements except for their disease status. And so we've gone out, we've collected data, and we found there's 112 cases, and we've selected 224 healthy controls. Of the people who got sick, 28 consumed EnduroBrick, and of the 224 who did not get sick, 56 ate the EnduroBrick. We also have those who consumed Quenchit. So of the cases, it was 50, and of the controls, it was 56. So what does that mean? Maybe none of this matters. So in order to really understand this, we are going to create what's called a 2x2 table. And so what we want to do is set up a table which will allow us to calculate the odds of exposure amongst the cases, the odds of exposure amongst control, and then compare those two things to get what's called an odds ratio. This is similar to what we did with the attack rate and the attack rate ratio. So here's our data at the top. We have a nice little, it's called the 2x2 table. So we have our outcome, Susser, yes or no, exposed, yes or no. One thing to remember is whichever box is here, so outcome, if your outcome is yes, you want your exposure, the first row to be yes, just so they line up. And so we can start filling in. So we have our total number of cases, 112. Total number of controls, 224, so case and control. The number of cases who ate EnduroBrick was 28. The number of controls who ate EnduroBrick is 56, and you can just use simple subtraction to fill in the other numbers. I also like to fill in all of the other totals. And now comes the data analysis. So, what are the odds of exposure amongst the cases? So, amongst all of our cases, 112, what's the probability that they ate? In this case, let's see, we were looking at the EnduroBrick. So, we have the odds. 28 divided by 84, that's 0.33. Right? So that's the ratio of consumed it to didn't. And then we look at the odds of exposure amongst the controls. Also 0.33. When we look at the odds of exposure compared to amongst controls compared to the odds of exposure amongst the cases, all we do are divide those things. So we take the 0.33 amongst the cases, divide it by the odds amongst control, and we get 1. Those numbers are exactly the same. It does not appear that EnduroBrick increases the risk. If this number were above 1, we would say that EnduroBrick, there's an increased risk of Susser associated with consuming EnduroBrick. If it was less than 1, so 0.5, we would say there was a lower risk of Susser associated with eating EnduroBrick. So we'll go to the interpretation again in a minute. A quick way of thinking about this is your odds ratio is AD over BC. A, D, B, C. So cross multiply and divide. You get the same number. So you can do it this way at the top, you can do it this way at the bottom. Either way is fine. It both works out. Rounding errors might change this ever so slightly, but that's okay for this class. Now we want to look at Quenchit, and we want to do the same thing. So again, we set up our 2x2 table, 112 cases, 224 controls, 50 of the cases drank Quenchit, 56 of the controls drank Quenchit, and we fill in the rest of our table. And we're going to do the same exact calculation. We want to calculate the odds of exposure amongst the cases. In this case, 50 divided by 62, which is 0.81. And we want to calculate the odds of exposure amongst the controls. What do you think that would be? 56 divided by 1.68 or 0.33. And when you compare the odds of exposure amongst the cases to the odds of exposure amongst the controls, you divide 0.81 divided by 0.33, and you get a number that is much higher than 1. It's 2.45. So you're almost 2.5 times as likely to be diagnosed with Susser if you drank the Quench-It. And again, you can use your ADBC, so you can multiply 50 by 168, divide that by 60 times 60, 56 times 62, and you would get roughly the same number. As you can see, there's going to be some difference due to rounding. So now you have this. You have the odds ratio for Enduro Brick is 1, and the odds ratio for Quench-It is 2.42. You have to now take your findings and present them to your supervisor. What are your conclusions and what are your recommendations? And I look forward to seeing your answers to this in the online discussion board.